Hey, this is Jason here with Ketamine Academy. Just wanted to answer the question that we get fairly common, which is, do I need a DEA license? Can I get a DEA license? And how does that whole process look like when it comes to starting a ketamine infusion practice? So the answer to that question is, obviously ketamine is a controlled substance, Schedule 3, so you would need, whoever's prescribing, I should say, in the practice needs to have a DEA license. Also, that provider can have their license associated with the clinic address in order to receive deliveries, or if that's not a possibility because maybe they're working at multiple locations, then the clinic needs to have its own facility DEA license. And so those requirements need to be met in order to just get a delivery. And then obviously anybody who's prescribing the ketamine needs to have a DEA license in their name to allow them to prescribe. So essentially any provider type who's allowed to prescribe a controlled substance can get a DEA license, and some states require that you also have a state controlled substance license or something similar, and so your board of pharmacy will let you know that. And actually, if you go to register for a DEA license and your state requires an additional specific license around controlled substances, then the DEA will decline your license and tell you that you first need to go to your state board of pharmacy or whatever it is and get a license through the state. Then once you have that and it's your name is registered with the state, then you can go to the DEA to get your DEA license. So the answer to that question is yes, a DEA license is needed in either the provider's name or the clinic's name in order to get a delivery. All providers need to have a DEA license, and you may also need to get a state controlled substance license or something to that effect prior to getting your DEA license.